World AIDS Day, and Kenya, of course, today joins the global community in marking this year's World AIDS Day. HIV and AIDS remains one of the world's most significant public health challenges of our time, particularly in low and middle income countries. Well, this year's theme is Getting to Zero. Now, ending stigma among adolescents and young people. First Lady Margaret Kenyatta will lead the celebrations here in Nairobi at the City Stadium. And we now want to speak to Agri Aluso shortly, but let's take a look at this story.
In Western Kenya's Homa Bay region, AIDS is a major problem, with studies showing that 1 in 4 people are HIV positive. Every day, a team from the medical charity Doctors Without Borders offer door-to-door campaigns in a bid to convince people to get tested. For many here, HIV is not really a priority issue. The number of new HIV infections worldwide may have fallen by 35% over the past 15 years, UN figures show. But the fight against AIDS is far from over in this rural Western Kenya. In Homa Bay's Ndiwa district, research done by MSF in 2012 showed HIV prevalence of 24.1%, meaning 1 person in every 4 was HIV positive, compared to the national average of 5.5%. What was more worrying was the rate of new infections that stood at 2.0% compared to the national average of 0.25%. Furthermore, the research showed that 41% of people affected have no idea that they are HIV positive. Some socio-cultural reasons in this area make it more affected by AIDS. The practice of jaboya is a commonplace whereby sexual favors are traded for fish. Prostitution is also widespread. There's also the tradition of wife inheritance, where a man marries a newly widowed woman from within his family.
We have to be aggressive now. We have to test everybody. We have to enroll everybody on care. And we have to be viral load suppression testing keenly. Then I think within the next few years, we'll see different figures.
37-year-old Lillian Atieno Ochola became HIV positive 14 years ago after she was inherited. The virus was allegedly passed on to her by her second husband. Then she passed it on to her son through breastfeeding before realizing she was infected. Since then, she has been trying to warn her neighbors of the dangers.
Well, this would be my advice. Before you get infected, please use a condom.
Although treatment is widely available in Kenya, UN figures show that in 2011, 72% of those diagnosed as HIV positive were being treated with antiretroviral therapy. There are still many other obstacles to overcome. Doctors Without Borders have warned that life-saving antiretroviral medicines are routinely not making their way to patients in sub-Saharan Africa, despite sufficient stock. A report released at the International Conference on AIDS and STIs in Africa called for urgent improvement in ARV supply chains in the region, stating that stockouts undermine efforts to fight HIV. In South Africa, a survey done in 2013 and 2014 showed between 20 and 25% of facilities experiencing stockouts. In the DRC, 77% of facilities experienced stockouts, while in Mozambique, 41% had experienced a stockout of ARVs over 3 months and again 41% over the next 3 months. Malawi is not immune to stockouts but suffers less from them than the other countries surveyed. 42% of 15 surveyed facilities had an ARV stockout. Another major in the fight against HIV/AIDS is the stigma surrounding those diagnosed